Hi, I'm Rashmi Dhital. I'm a first-year rheumatology fellow at UCSD here at RWCS 2022. I'm going to talk to you about my poster today, which is called Hospitalization Due to Serious Infection in Adolescents and Young Adults with SLE. So SLE patients have a higher risk of infection compared to general population, which if serious can lead to hospitalizations. We were specifically interested in adolescents and young adults because of data suggesting disruption in care and delays during transition of care during this time period. And also there have now been prior studies specifically looking at rates, predictors, and outcomes of infection-related hospitalizations in these young SLE patients compared to older patients. So for our study, we used a large US inpatient database called the National Inpatient Sample, which represents about 35 million hospital discharges per year. And we categorize patients as adolescents, young adults, late adults, and older adults to study rates of infection-related hospitalization over a 10-year study period. So we found that patients, So we found that patients with SLE have a higher rate of infection-related hospitalization compared to non-SLE patients across all age categories. Also, interestingly, young adults with SLE, so adults 18 to 24 years with SLE, had an infection-related hospitalization rate that was higher than late adults and similar to older adults over 50 years of age. Also, length of stay and cost of hospitalization was similar in young adults compared to late and older adults with SLE. So to highlight some of the limitations of the study, although NIS database is a large nationally representative database, some limitations include use of ICD codes used for billing, as well as cross-sectional nature of the database with no information on labs, imaging, and immunosuppressive medications, which would have been important for our study question of infection-related hospitalization. Now, so to conclude, young adults with SLE have a rate of infection-related hospitalization higher than late adults and similar to older adults over 50 years of age, with similar length of stay and hospitalization cost, and the reasons for this finding needs to be explored further.